Yeah, so my name's Rachel. I'm a clinical research practitioner. I've worked in clinical research for over 20 years now, and I currently work in a hospital-based clinical trials unit and been studying at Exeter University. I was really happy when I got asked to talk about the course because I felt like it's been a really positive experience, not only for my own self-development, but it's also had a real positive impact, I would say, on my work, which has filtered down to my colleagues and my department overall. I can remember sitting and listening to the presentation last year and being keen to apply as it sounded really interesting, but also kind of apprehensive about how the heck I was going to fit in all this studying, working nearly full time and a busy mum of three. But now I'm on the other side. I would say that it's completely possible for anyone, but you do need organisation, you need lots of dedication, and I would say you need an understanding boss and supervisor. Unfortunately, I don't get any protected time, but my boss has been great with the research practice module. They've allowed me to go out to as many meetings and as many visits to other departments as needed, and also take the time for the face to face meetings for the course as well, or online face to face meetings. The rest I've done the at home on evenings, and I've also taken like a handful of annual leave days to complete assignments. So just bear that in mind. There is a commitment there. But for me overall, it's been really worthwhile. I've learnt lots and lots, and it's really given me the confidence to go on and use the knowledge in my own practice. It's not just been a academic process. I would say the learning's really varied. I took an optional statistics module, give me a really good understanding of how to use and interpret statistical tests, to co-producing a research advertisement with a member of the public. There's been lots of reflective practice as well, I would say, along the way. So the research practice module has been fantastic. It allows you to go out and fill the gaps in your knowledge of how research works, and you can really tailor it to what your gaps are, what you want to learn. I've been able to find out, for instance, firsthand what support different departments in the CRN can provide. I've attended an ethics committee meeting. I've discussed structure and funding within my trust R&D department, and I've gone out to other departments in the community as well to see what challenges they face. And overall, I've just gone and had a good old nosy at how people do things in other departments and what they do. It's really helped me kind of understand the full research environment, but also helped to change practice, I would say, within my department. Finally, I've learnt in the process what motivates me and what I want to develop further. The research practice module allowed me to create links with local CRN resources that will help to engage minority groups in our research. It's also helped me to have a greater understanding of PPI, how it works locally, what groups are out there, how it's funded, and I've been lucky to observe some brilliant local advisory and co-production meetings, which has really motivated me to develop our own respiratory advisory group, which I'm currently in the process of setting up with a colleague. And I probably would never have even thought about doing that before the course, and I certainly wouldn't have had the knowledge or the confidence to do it. So overall, I would say it's a fantastic learning opportunity that's completely relevant to anybody working in clinical research or wanting to work in clinical research, from those that are just starting out to old timers like me. And as I've learned, you're never too old to learn. So thank you for listening, and good luck with your applications and future studies.